Today's topic, syncope. Syncope means it's a most common medical emergency in a dental clinic, and it is associated with all forms of dental treatment, but mostly with tooth extraction and other surgical procedures, and most frequently with the administration of anesthetic. Syncope is a general term referring to a sudden transient loss of consciousness that usually occurs secondary to a period of cerebral ischemia. The other names for syncope are vasovagal syncope, neurogenic syncope, psychogenic syncope, atrial fibrillation, common faint, zone, etc. So, other predisposing factors, basically, syncope need two factors, that is the psychogenic factor and the non-psychogenic factors. These factors can precipitate vasodepressive syncope and classified into two groups: psychogenic factor, non-psychogenic factor. So psychogenic factors are fright, anxiety, emotional stress, receipt of unwelcome news, pain that can be sudden or unexpected, sight of blood or instruments. These factors can lead to the development of the fight or flight response in this patient, and in the absence of muscular movements by the patient, produce the transient loss of consciousness known as vasodepressor syncope. Non-psychogenic factors: erect sitting or standing posture, hunger from dieting or missed meals, exhaustion, poor physical condition, hot, humid, crowded environment, male gender, age between 16 and 35 years. So signs and symptoms of syncope. So basically, syncope can be divided into three stages: pre-syncope, syncope, post-syncope. Pre-syncope, the early signs and symptoms: feeling of warmth, loss of color, pale or ashen skin tone, heavy perspiration, feeling bad or faint, nausea, tachycardia, BP coming down to baseline or slightly lower. Example, it may be around 90 by 60, 90 by 50, etc. Late signs and symptoms: pupillary dilatation, yawning, hyperapnea, cold hands and feet, hypotension, bradycardia, visual disturbance, dizziness, loss of consciousness. Syncope with loss of consciousness may become jerky, grasping, quiet, shallow and scarcely perceptible, cease entirely, then pupil become dilate, convulsive movements and muscular twitching of hands, legs or facial muscle may occur. The bradycardia means it may be less than 50 beats per minute is common. Weak, thready pulse can be facilitated. In severe cases, ventricular asystole may occur. BP falls to an extremely low level. Pulse become weak, thready. Partial or complete airway obstruction due to muscular relaxation. Fecal incontinence may occur. So pathophysiology is vasodepressive syncope is most commonly precipitated by a decrease in cerebral blood flow below critical level. It is usually characterized by drop in blood pressure and slowing of heart rate. And it has indirect factors such as hypotension, hypovolemia, hypometabolic disorders, neurogenic. So since it is neurogenic, it's the vagus nerve is the most common cause. Vagus is precipitating. Syncope occurs when cerebral blood flow is below critical level. That critical level means below 30 ml per 100 gram of brain. In upright positions, heart's ability to pump this critical volume is impaired and minimal cerebral blood flow is not reached. Convulsive movements such as tonic or clonic seizures of arm, legs may occur with onset of syncope. Cerebral ischemia lasting only 10 seconds can lead to seizure activity. So post syncope, this thing is severe headache, and patient will be still may not be able to recover and in a dizzy state. The management of syncopal patient differs depending on the signs and symptoms and the individual exhibits. The management of four separate stages can be done, that is pre-syncope, syncope, delayed recovery and post-syncope. Pre-syncope, step 1, that is position. As soon as the pre-syncopal signs and symptoms occur, dental procedure should be halted. The patient should be placed in supine position with leg slightly elevated. Muscle movements help in returning of the blood from the periphery. Position change usually halts the progression of syncope. Shake and shout maneuver. Look, listen, feel technique. This is to find out whether the patient is having the respiration or not. Spontaneous respiration is usually evident during syncope. Artificial ventilation may be necessary on those which spontaneous breathing ceases. Positioning and establishing the patent airway speeds up recovery. Artificial ventilation can be given to assess the circulation. Carotid pulse must be palpated through though rare ventricular systole can develop during syncope. Weak thready pulse is palpable in neck. Heart rate is quite low. Carotid palpation, how to do? It is between the sternocleidomastoid and the thyroid cartilage. You can feel the palpation. Step 5 is the definitive care. So administration of oxygen. Oxygen can be administered at any stage of syncope. Monitoring the vital signs, blood pressure, heart rate, respiratory rate should be monitored and recorded. Then ammonia vaporol. This is to irritate the nasal mucosa so that the respiration movement start. It helps to expand and contract the lung so that the blood flow is pumped into the blood, and that blood is pumped out of the heart and it will go to the vital centers so that the ischemia will be reduced. So this vaporol acts as ammonia acts as a irritant. A cold towel may be placed on the patient's forehead. Blanket can be provided if the patient reports feeling cold or shivering. If bradycardia persists, an anticholinergic such as atropine may be administered either intravenously or intramuscularly. Action of atropine is a vagolytic agent. So I first told you the syncope is due to the vasovagal action. So vagus is acting on the blood vessel that causes the peripheral pooling. The precipitating stimulus such as syringes should be moved out of sight. Delayed recovery. If the patient does not regain consciousness after procedures are performed, or does not recover completely in 15 to 20 minutes, a different cause for syncope may be present. Emergency medical service should be provided. Basic life supporting measures should be administered. Post syncope, after the recovery from the syncope, patient should not be subjected to additional dental treatment. Possibility for second syncopal attack is more during post syncopal phase. Prior to dismissal of patient, doctor should determine the primary precipitating event and other factors led to the syncope. This is for the planning the future treatment. So management of vasodepressor syncope in nutshell: assess the consciousness, activate the office emergency system, position the patient and supine with feet elevated slightly so that the gravity will aid the blood flow to the brain, or the head should be down to the compared to the heart. ABC: assess open airway, assess airway patency, breathing, assess circulation. Definitive care: administration of oxygen, monitor vital signs, perform additional procedures like administer aromatic ammonia vaporol, administer atropine if bradycardia persists. Do not panic. Post syncopal recovery: postpone further dental treatment. Delayed recovery: activate the emergency medical service, determine the precipitating factor. So drug use are oxygen, spirit of ammonia, atropine. Medical assistance: a delayed recovery of consciousness or delayed return to normal status needs medical attention. A medical emergency care should be provided for such patients. Prevention is better than cure. In order to prevent the syncope in your dental clinic, eliminating factors that predispose the individual to faint, proper positioning of the patient in the dental chair, anxiety relief for the patient. Thank you.